Hello, Dr. Johnston coming to you from Denver, Colorado. Today I would like to talk to you about the anatomy of a tooth. Believe it or not, a tooth is a pretty complex thing. In dental school we had a class on tooth anatomy, and our final exam was they would pour a bunch of teeth out on a table and tell us, hey, what number of tooth is this, what tooth is this. So it's fairly interesting. Every tooth in the mouth has a different anatomy. It's built a little different than the other one, so it's kind of fascinating. Well, what I want to get into is the main parts of just any tooth. Teeth are comprised of enamel, which is the white outside shell we see. This is what we brush and floss and keep clean, this enamel. Underneath the enamel is called the dentin. The dentin is composed of all these microtubules. So dentin is a sensitive part of a tooth. And then underneath the dentin is this chamber called the pulp chamber or the nerve chamber. This is an empty space that is filled with blood, nerves, and arteries and veins, microscopic arteries and veins. A tooth is a living organ. So these nerves inside the tooth kind of branch out microscopically inside the dentin. So anytime you have a dental filling that goes into the dentin, it could be sensitive. We have to seal up all these tubules. So around the tooth is encapsulated in the jawbone, and the bone is right here, and around the jawbone makes up the gums, or the what's called gingiva in dental terms. And right beside the bone and the tooth, there's a little microscopic ligament that pads the area between the bone and the tooth. This microscopic ligament down here is called the periodontal ligament, and it's actually what gives us the sensation of what's called proprioception. And proprioception is how we know if we're biting on something hard or soft. So that's kind of a neat thing we have is you know, these ligaments can tell us, hey, we're biting on something soft, or hey, this is really hard, be careful. All these things happen really fast and goes to your brain really fast, but this is the anatomy of a tooth, and it's, you know, very basic video today, but I think it's nice to understand how teeth can be sensitive. It's the anatomy, you know. If the gums recede, then we show this sensitive part of the tooth right here, and your teeth can be sensitive. If the gums are inflamed, that can also cause the tooth to be sensitive. So it's a very complex, little complex organ there that we have. So we'll come to you next time with another subject, and hope you understand the anatomy of a tooth. Thank you.